Okay guys, here we are. Today we're going to be demonstrating here on the left shoulder with cups, of course using the motion cups for fascial release, while I use my hands a little bit and my body weight to lift the shoulder, mobilize it, and we're going to be focusing on frozen shoulder issues, rotator cuff issues in the fascia, underneath the scapula and around it, brachial plexus compression issues, and to kind of gently and intentionally and slowly release that fascia around that thoracic rib cage, the lateral left side of the spine, for opening up that fascia so it's not compressing nerves, blood vessels, lymph vessels, so blood can get in, lymph flow can move, fascia isn't compressing the structure, which will cause, sometimes that brachial nerve pain down the arm, into the hand, into the wrist, and into the neck as well. And just causing people to have that tension and stress in their neck, brachial plexus area, shoulder, and thoracic rib cage. I'm going to use, again, my name is Marlittle LMT. Craniosacral and cupping is my specialty, so I like to combine relaxing that nervous system mixed with the fascial work, with the cupping and using my hands to do both kind of at the same time. I am also certified in lymphatic drainage, so I'm kind of always blending those components of releasing fascia, helping to change that fight or flight nervous system response to rest and digest as much as we can, and open the myofascial connective tissue. So I like to just right now use a little bit of oil on my cups just so I get the movement along with this suction, which actually feels really good and doesn't pinch as much. Dry cupping is great too if you're looking for blood stagnation and you're looking to break those capillaries so they heal again and toxins can move out, new blood moves in. But I don't do that a lot. I love using these as a myofascial tool. So we're using a decompression method of deep tissue, which I prefer as to compressing down with my body weight. It really opens up those fascial layers without a lot of pain. And it feels good most of the time for people. If it's someone who is an elderly client, their skin is going to be really thin, I wouldn't use cups on them. I would just use my hands to do the fascial release. So I'm just going to start by just engaging into the tissue. And then you're just going to suction that tissue. And I'll, move it in different ways, different paces, just depending on what I feel. You'll feel where the tighter areas are. And just going around that infraspinatus, medial border through rhomboids, into traps and upper trap, levator, and then around that supraspinatus border, rotator cuff. You're gonna wanna just kind of experiment, because some people, they get very sensitive around like the teres major, teres minor area. But you can go there once you get this area a little bit more Released. And how's this feeling?
Wonderful.
Good.
I didn't realize how tight I was.
And may I just kind of describe the shoulder on the side?
Yeah.
Okay. So Anne's had some, you know, just that forward posture, shoulder issue. You get sometimes the nerve issues down the arm if someone's working at a computer all day, having to sit, having to drive. And then a lot of I talk about emotional holding patterns in the tissue too, when it relates to the nervous system getting stressed out, cortisol going up. A lot of people tend to hold it then in the tissues around it can be the sacrum too, pelvic area, but a lot of that upper thoracic, brachial, neck area. It can either cause headaches or a lot of pain in the shoulders and rib cage. And I'm gonna start adding in the other cup. And I have larger cups, guys, for the, I don't do legs much, but I will do the IC band sometimes if I feel like it needs it. But the larger cups for the lumbar area and the QL area of the lower back work really well. Usually I'll just use one. Today we're just focusing on the left shoulder. And I always stress, you know, and it's an opinion, but I don't do the painful, fast, aggressive, deep tissue. Life compresses us enough. I don't want to do the same. I want the person to feel better and decompressed and relaxed when they leave, even if we are doing deeper work on the back. The biggest, most important thing to me is that the nervous system change happens. And that's why I combine in a lot of my sessions the craniosacral work with the cupping, and I'll do the cupping first and then do the craniosacral with the person face up. And generally they'll say like, they get that full interconnective release feeling in their nervous system, but their fascia will deeply be worked into at the same time. And we don't have to do both at the same time. We can always, I have clients, you know, that sometimes only get the craniosacral work. So it's all an option. You can combine it. You can do just cupping, just cranial. I just love both modalities. So I'm getting that nice redness to the tissue. Now, if I did dry cupping, you would have those, they call them cup kisses, for maybe a week is the longest it should last, you know, and it's not necessarily bruising, it's actual broken capillaries that then heal. So we're causing inflammation to get new blood in, old blood, stagnant blood out. And the darker the cup kiss is, they say, more stagnation in that area. I don't generally do it that way. I like using them as a fascial tool. You don't want to go, I try and stay, you want to stay off the vertebrae. You can go closer to it. It just depends too on the person and how the thickness of skin, tissue, the different types of tissues you're dealing with. You want to be really careful with people who have hemophilia. Wouldn't do it on somebody like that. Elderly people with really thin skin, that's kind of a no. It is a no. Contraindication. And has there been any like pinching or anything like that? It feels good to you?
Yeah, no, it feels really good.
Good.
I feel like you're loosening up something.
Yeah, it's the tissue. It's the deeper fascial layers, and we're getting a lot of red blood flow now, which is great. But with the motion cupping with the oil, you're getting the blood to the tissue, but you're not gonna have the cup bruises that dry cupping would cause. So then I'm just gonna, sometimes you just resuction and then move again. And sometimes you do want to hold stagnant for a couple seconds to really get that blood flow to the outer superficial layer. And now her teres area is ready to be worked on. You could just tell there's all that, it's loosening up more, it's moving more, it's not as, generally I'll just use one there along that lateral border, resuction. So now I want to kind of mobilize the shoulder. So I'm going to remove the cups because we don't want to leave them on the tissue for too long when we're doing this kind of modality this way. So I'm going to put them back. And first I'm going to start now you want to be careful when you're kind of mobilizing around the scapula. This feels really good usually for people, but for somebody who has a lot of sensitivity in the tissue around the elbow, that epicondyle area, the cubital area in their arms, which can be sensitive, I don't want to be pulling the tissue on the arm. What I'm doing is I'm gripping in and lifting it with my body weight. So I'm not pulling on the arm tissue, but I'm using my body weight to get that in that coracoid area below the clavicle, to get that starting to move so that the clavicle isn't sticking as much and the scapula isn't sticking as much. So getting that whole fascial area around the clavicle, which is, the anterior clavicle area. And then through that coracoid process here and around the scap, we're just mobilizing right now. Okay, so I do use my hands when I'm doing the cupping portion too. And then I'm just I have my forearm under her cubital area of the elbow, and I'm gonna take one cup. It's kind of like baking. I'm gonna take one of the cups, dip it in the oil, and now I'm not left-handed, but we'll see how this goes. So I got it suctioned, and I'm just gonna take my body weight. Again, I'm not trying to pull on her arm, but I'm moving in my hip area. I'm moving with my body while I'm moving the cup to really start releasing not only this area that I'm working on with the cup, but the anterior area around that left thoracic rib cage and around the clavicle.